Okay. Steve, a question for you regarding employers. It's been a challenge for employers to retain their employees, but they certainly have been challenged by the federal government to do so with the legislation that's been passed. How are you managing employee retainment?
Yeah, so our employees are our most important resource through this entire time, and our associates. First of all, first and foremost is their safety and helping them feel safety while they're in the work environment. That means all the way from who cleans the facility to who maintains it to the frontline nurses and doctors that are there. So one is getting the proper personal protective equipment and helping them. Those guidelines have changed as we come out, as Dr. Brunken I'm sure will cover from the CDCs, but that's one. I think then we are encouraging as much staff as possible that's in a non-direct role to work from home. And giving them the opportunity to do that. We're redeploying staff to various areas and cross-training, as I said earlier.
Excellent. Another question regarding employers, and this is for you, Joni. This is Kathy from Sealyville. What happens if a business that is essential has an employee who tests positive for the virus? Is the employer notified? Are coworkers notified?
HIPAA still protects an individual's medical testing result. We start investigations on communicable diseases at the Vigo County Health Department. And what we would do is work with the person who tests positive to see what type of work they had, who they've been around. And if we feel that it's necessary to tell the employer, we'll tell the employer. We've worked with employers before with other communicable diseases. But what we found with COVID-19, people that are positive are very open with their employer because they want to protect the other people that they worked with. They want to protect the other people that they were around, and so we found that that hasn't been an issue, but HIPAA still does protect that person's medical rights.
As a follow-up question to that, again for you, Joni, is my employer required to give me paid time off and or FMLA leave if I am sick or have tested positive?
I think as president of the chamber, you would be better to answer that question than I could.
Sure. So I'd be happy to offer a little bit of information. There is new federal legislation that does provide for paid sick leave and expanded FMLA for individuals who are sick, have tested positive, or also have childcare issues because of the closures of school. There's a lot of complicated information that goes along with this. The federal government did roll it out very quickly. There are a lot of rules, but there are a lot of exceptions, including for essential workers who would not be eligible for those things. The Chamber has a resource page that you are welcome to look at on our website that has lots of links to information. The Indiana Department of Workforce Development is rolling information out daily. There is a lot of clarification that needs to happen around these things, but the short answer is yes, most likely, but you need to inquire a little bit further. Next question goes to Dr. Patel. How can you calm fears with your patients and really in the community at large?
Well, first, this is a very exceptional time, but I do feel reassured that we are surrounded by exceptional healthcare providers, from the first line responders, the EMS, the fire department, to the nurses and respiratory therapists that are truly in the thick of it every day. We've been meeting as a group of physicians and physician leaders frequently via teleconferencing at least 3 to 4 times a week to discuss the newest updates in healthcare delivery for this disease, as well as what our local abilities are. And I think, as you've heard, we do have quite a few resources available to us. And one of the most reassuring things I saw today walking into the hospital was the empty beds. They're everywhere. We have an ICU that is only at a quarter capacity currently at Union, with an extra unit available if necessary. And so I do feel that we are prepared, and now it's a matter of working with the community to flatten the curve so we don't overwhelm the capacity that we have built.
Question back to you, Dr. Brecken. This is from Wanda. Is the virus airborne?
This is a respiratory-borne virus. So yes, it is airborne, but airborne means a variety of things. Droplet transmission are the larger things that are excreted from our body, and they fall typically close around us. These are covered in saliva and mucus and things. This would be expelled during a deep cough or a sneeze, the things that you can visually see come out of someone's mouth. That is the importance for masking, because these masks that we're recommending in the community, all the way from the CDC and down to myself personally, if you're wearing a mask, it's to prevent your particulate matter from escaping your body. The larger droplets, we believe from laboratory testing, are the most contagious to other people. There is a fine aerosol that theoretically could also be there. We worry about our healthcare providers as well. We use special masks called N95, which limit the transmission of the aerosols in the air. We do know it comes from the air. It is not foodborne. You can't get this from eating it or ingesting it. There are comments about fecal oral transmission, and yes, we can see it in stool, but we've not been able to pin that down. So you have to protect yourself from the air immediately around you. And remember that the universal masking is to protect others from you, not you from others.
I think, could I emphasize what Dr. Brucken mentioned about the N95 masks? Those aren't necessary in the community as a whole. The standard cloth masks that everybody has been making and delivering to the hospitals, which we are very grateful for, are more than adequate to protect yourselves and protect others around you from transmission. N95 masks are designed for high-risk situations, such as during CPR or when a provider is putting a breathing tube in somebody that's infected, to prevent those very fine particles from infecting the healthcare provider. So do not feel that you need to wear an N95 mask. And if you have clean, unused ones, please bring them to your local fire station or the hospital or clinic near you.
Excellent.
Thank you. Dr. Patel, question for you. You are a cardiologist. How has COVID-19 altered your cardiology practice today, and what do you want your cardio patients to know at this time?
We've been teaching a lot of 80-year-olds how to Zoom in the last few days. Today I saw 10 patients, which is a lot less than I typically see in a given day, but we triage them to identify the highest risk patients that still need standard cardiac care to prevent them from getting sick, so we can avoid them ending up in the hospital for other reasons. So we are doing telehealth in our office, which is becoming more and more prevalent. So for patients and the community out there, if you are not feeling well and you are scheduled for an appointment with a provider that is offering you telehealth services, I urge you to take them up on that, because that's what's going to keep you healthy in this time and keep you out of the hospital where it could be more detrimental to your health.
Absolutely. Brendan, question is for you.
Sure.
What is being done to help the homeless population through this pandemic?
Well, Kristen, that's a tough one. I'm going to kind of wing it, if that's okay. All of us in this room here deal with the homeless in some form. Dr. Brucken and Joni and I were talking about a situation, I think on Friday, about a person that was seeking care because they haven't had a meal in 4 or 5 days. And I'll leave it at that. But last July, we did a count in Vigo County, and it proved to us that we have about 600 people that are considered homeless in Vigo County at that time. During the wintertime, we saw our numbers decrease, but we're starting to see them come back. This has been a very interesting exercise, where the places where the homeless congregate during the day are shut down. The Vigo County Library has become our unofficial day center, our gathering place for our local homeless. They go there to use the computer, they seek shelter, the bathrooms are there. It's closed. And then the other locations they hang out are certain restaurants that allow them and feed them. They're closed. And so, it's changed everything for everybody, but in particular with the homeless community, it completely disrupted them. We have housed homeless, people who are in shelters. And I tell you, a lot of our greatest fear is if that shelter, a shelter, has one case. And the shelters that I interact with, that Joni interacts with, they have isolation plans in place. But you just hope that you catch it in time. And, there's so much uncertainty with this. We just hope to God that this does not happen. I've worked with a couple shelters on ways to get the people who are housed inside outside by having them on the same campus in tents. There's a lot of things that we're doing in the background, but something, if there is any benefit to being homeless, and this is going to sound twisted, homeless are isolated people. Today I interacted with 6 homeless individuals in one area. They were spaced apart from each other. Checked on them, seeing how they were doing. I checked on a couple other people. They're staying away from each other because they're isolated by nature. But we're seeing an issue with our food banks right now, or not our food banks, our soup kitchens right now. Soup kitchens that were open 5 days a week have gone down to 3 days a week because they're experiencing a volunteer shortage. So it's an ongoing issue. We're reactionary in everything right now, and we're just doing what we can to ensure that everybody's safe. But the homeless population is very vulnerable, and Vigo County is an awesome community. People step up. We volunteer, we help as we can, and we are absolutely seeing the strength of this community right now in this situation.
Agree. Dr. Brecken, question for you. This is Dave from Park County. Can the microwave oven be utilized to kill the virus, and how about putting patients in a hot room?
Kind of speak to this in general terms. This virus, once it's on various surfaces, is really not all that hardy of a situation. Plain old soap and water can eradicate the virus from your hands. The countertop surfaces, the non-porous surfaces, the virus can survive, we believe, for 2 to 3 days at most. And that's why we encourage people wiping off with any household cleaner. You can make your own cleaners at home. The CDC actually posts a very nice list of how to make your own cleaners if you're running low on your supplies. Hand sanitizers, washing your hands effectively. Heat theoretically could deactivate really anything, but we're not encouraging anyone to put items in the microwave. Okay, as Brendan pointed out to me earlier, masks, just like the ones that I wear out in public, they can contain a piece of metal. If you're using cloth masks at home, you do not need to microwave them. You can put them just in your regular wash. Good old laundry detergent kills the virus as well. And again, it just speaks to the cleanliness issue. Now, with porous surfaces like clothing and things, it's going to be absorbed. You're not going to necessarily have it off of you. Anytime you're handling, though, a porous substance, you need to be thinking about, my hands are now dirty. I need to get to the sink and wash my hands with soapy water. 20 seconds. Say a little nursery rhyme in your head, whatever you need to do, and making sure we're educating our kids and our older kids in our household how to wash your hands appropriately. And the same goes with hand sanitizer.
Absolutely. Joni, this is a question for you. It kind of relates back to something we talked a little bit about earlier, but this is from Ray. Expand a little bit about how the county handles notifications when someone does test positive, and how close of contact must they have been with that person in order to be notified?
Okay. Both hospitals have 24/7 contact information for health department employees. And so we're notified immediately, and then our head nurse that's working on, or excuse me, the nurse that has been handling the lead investigation notifies the patient right away. And then she starts the immediate contact investigation to see who that person had been around and all the, where they worked, did they live with people, have they traveled, a whole battery of questions. Our environmental division staff and our nurses also do part of these investigations, and I have to say they have a list of questions that they go off of, but they also think outside of the box and they use common sense. The second part of the question in regards to how close of a contact, there are so many different variables. Were you inside with the person, outside with the person? Were you in an elevator? How close of a contact were you with them in your working environment or your home environment? Were you in an elevator and a person sneezed, or were you in the office when they were coughing and sneezing? Did they wear a mask? But again, those are things that we go through when we do the contact investigation and questions that we ask the people that they were around. And I find that the people that are positive have just been so cooperative, and same with the individuals that are contacts of them.
Absolutely. Dr. Patel, question for you. How can those struggling with mental health issues get outpatient services?
I think the first thing is, if you are established with a mental health care provider, you still reach out to them directly. As I mentioned, telehealth is now available. Not every provider may have the capacity to do that, but I think the first place to check is with your own mental health care provider. And if that's not available to you and you feel like you are a danger to yourself, or if a family member feels or a friend feels somebody is a danger to themselves or others, the emergency room is still an appropriate place for those individuals. You can also call the Union Hospital hotline or regional hospital as well if you are in distress to obtain care.
Absolutely. Perfect segue. Our next question is for Steve about the Union Hospital hotline. Talk to us about its availability.
Yeah, so Union Hospital is staffing a hotline. We call it the COVID-19 hotline. The number is 812-238-4871. That's again 812-238-4871. It is staffed by clinical nurses, registered nurses, and it's open Monday through Friday, 7 a.m. to 7 p.m. We tried it, and it is there as a resource for the community to answer any question or to get you information, to get the community information about any resource that's needed, whether it's symptoms, whether it's treatment, whatever, testing, whatever it may be. We did have it open 7 days a week. We're getting about 150 calls a day, and we've had over 3,400 calls on that hotline so far. So there's a lot of questions out there in the community. We did find the first weekend the calls really dropped off, so we weren't covering the weekend. If we do have a demand for it, we'll open it up on the weekend.